The most that I enjoy is getting to know the whole person, because the illness does not define that person's life and their meaning and purpose here on earth.
Welcome. I'm Tricia Ford, Interim President of Colorado VNA. I appreciate your interest in learning about career opportunities in home health, hospice, wellness, and palliative medicine. Today, we're going to introduce you to what we do and the opportunities for nurses in our specialty. Our various lines of care, like home health, are not just places of care. Rather, they are a philosophy of care that meets patients where they are, physically, emotionally, and spiritually. We visit our patients and their loved ones where they are, in a private residence, nursing home, assisted living communities, or at the hospital. We tailor an individualized plan of care for each of our patients, focusing on their goals for comfort and maximizing their quality of life and time with family and loved ones.
My typical day can be including giving insulin injections, helping people with their medications, setting up their medications for them, helping them take care of a wound of any type or size, location, helping people with IV foods, nutrition, or medications and IV antibiotics, and learning how to take care of themselves in chronic disease processes.
So for me, I'm currently in a weekend role where I cover the case managers while they're off, and I get to see a wide variety of patients and situations. I go all around and see people, anything from pain crises, respiratory crises, death, simple things like troubleshooting a urinary catheter, patients in their home so that they don't have to leave the comfort of their home and expend their minimal energy that they have going to the doctor or to urgent care or the ER. We go right to them.
As a wellness nurse, I usually work outside of the facility here at the office, and I go to different rec centers and churches, and some all like assisted livings or resident care places. And then I do foot care for the most part. I've been doing COVID vaccination, flu shot clinics. It's a wide range of stuff that I do, but for the most part, it's probably 80% foot care for older adults, and then 20% the other stuff.
Collaboration is very important. I am big into making sure my patients have all of the disciplines involved in their case that they need: physical therapy, occupational therapy, speech therapy, social work to help them get community resources in as they need, and then even referring them on to palliative or hospice care, other service lines that we have available to them to help them out long term.
I love working with the nurses that I work with, and then it's just nice to continue that rapport with the patients, and it's kind of a non-pressure, easy kind of job.
The most that I enjoy is getting to know the whole person, because the illness does not define that person's life and their meaning and purpose here on earth. And the best thing about hospice nursing is I go to their home and I see their family, their pets, their trinkets, their achievements on their wall, their personality and their decor. That defines that person much more vividly than just seeing them in a hospital room at any given moment in a glimpse of their life. And so I find it rewarding to be able to go in and see that person and give me a whole new perspective on painting the picture of the dash between the person when they were born and their life and what they've done with their time here on earth.
The biggest thing is just, like I said, developing that rapport with the patients. And, and there have been times when their health is deteriorating and you're just a good shoulder for them to discuss things with, and they trust you because they've known you for several years or 6 months or whatever the time period is, and you're another source of information that they trust to kind of bounce things off of. So that's kind of nice.
Thank you for joining us today and learning more about the role of home health, hospice, wellness, and palliative care nurses. We hope that you will consider a rewarding career with us and join our team, making a difference to so many during one of the most meaningful times of their life.